Now, the most popular question that I encounter in my OPD regularly is that nobody wants to wear glasses. Namaste, this is Dr. Soumya from Sight Avenue, cornea and refractive surgery consultant with an experience of more than 10 years. Now, the eligibility criteria for people undergoing spectacle removal surgery is: first, the age. You should be more than 18 to 19 years of age. Second, most important is your number should be stable for at least 6 months to 1 year. That means there should be absolutely no change in glasses. Second, your corneal thickness. Now, again, coming to what the corneal thickness is, we decide on a suitable procedure that is suited for you to help you get rid of your glasses. Now, the third most important eligibility criteria is we check for your corneal thickness and we do a corneal mapping for you. Now, what is cornea? Cornea is the outside layer of the eye. So usually what people have this misconception is that any surgery related to eye, we need a cut and we go inside the eye. No, it is not that. Refractive surgery usually happens on the outside of the eye. It is a painless, bloodless procedure in which we do not enter the eye, but we only operate on this glass-like structure that you see outside. Now, corneal thickness is the most important factor. Depending upon your corneal thickness, we decide which procedure is best suited for you. Another condition that we need to ask you is your family history or your personal history, in which we ask you if you're suffering from any diseases like rheumatoid arthritis, Sjogren's syndrome, or severe dry eyes, if you have a history of any viral infections in the eye or in the body, because these are certain conditions which prohibit you from getting a laser refractive surgery. Another condition is a pregnancy or a lactation. Now, during a pregnancy, we do not recommend laser refractive procedures because of the hormonal changes. Similarly, as in lactation, so what we recommend is that post-lactation 2 months, you can again visit your eye surgeon for a proper testing and a laser refractive procedure which is best suited for you to be discussed to you, and depending upon your eligibility, you can undergo that procedure as well. Now, there are certain conditions which are an absolute contraindication, or by contraindication I mean that you are not eligible for any of the refractive procedure is: first, if your cornea mapping is abnormal or there is any abnormality that is detected in your cornea. Thereby, having said that, I do not mean that you cannot undergo a second procedure which is suited for you to help you get rid of your glasses. I'm going to talk about some systemic conditions first. One of the most important condition is glaucoma. If you're suffering from glaucoma, we do not recommend any refractive procedures on you. If you have an HIV or a viral infection, we do not recommend any refractive procedure. Similarly, in the case of arthritis or Sjogren's syndrome. So these are certain systemic conditions which you need to discuss with your eye surgeon, and thereby your eye surgeon will tell you in detail whether you are eligible for any of the refractive surgeries or not. Now, for thinned out cornea, we have another procedures like ICL or phakic IOLs, where we put a contact lens kind of a thing in front of your natural lens. That's a separate topic that we will discuss later. Now, laser refractive surgery is an absolute no-no for you in certain conditions. First, which is most important, is if you've undergone a corneal mapping and there is any pathology or any disease process that is detected in your cornea. Second, if your cornea is really thin, that means that we cannot do any of the laser refractive procedures on you. Third is a few of the systemic illnesses like diabetes, Sjogren's syndromes, arthritis, any of the viral infections in the eye. Now, there are few conditions which are an absolute no-no for you to undergo any of the laser refractive corrective procedures. One of the most important condition is that if you've undergone a corneal mapping and your corneal mapping is abnormal, that means that there are certain conditions which might give to any ectatic conditions in the cornea, we do not recommend you undergoing any laser refractive corrective procedures. Second is your systemic illnesses. Systemic illnesses like Sjogren's syndrome, which causes severe dryness in the eye. If you are suffering from rheumatoid arthritis, if you have a history of HIV or any of the viral infections in the eye, you are not a candidate for any of the laser refractive corrective procedures.